despite all the videos, despite all the webinars, despite all the articles, there still seems to be some confusion regarding what you can or cannot count in evaluation and management when it comes to the data section. In this video, I'm going to talk over one good news and one bad news. These are actually nothing new, because these technical corrections came out in March of 2021. So these are nothing new, but I think it may be new to a lot of you. I apologize in advance for my voice. I'm recovering from a cold, so I don't sound the way I normally do. All right, for those of you, I know a lot of you joined recently. For those of you who don't know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. Let's talk about what happened back in March of 2021. In January, AMA CPT panel put out a new set of guidelines when it comes to evaluation and management. As soon as March of 2021, they came out with a set of technical corrections. Within the technical corrections, they clarified a few things. So number one, one of the items they discussed was, let me see if I can switch this over. This is according to the AMA's Evaluation and Management Office or other outpatient and prolonged services coding guideline changes effective January 1st, but technical corrections were posted on March 9th of 2021. This is almost 2 years old. And so I'm going to jump over to page 6, which is something that Austin brought up in the Thriving Urology Practice Facebook group. Under the test section, right here, if you look at test, under the test section, under unique, all right? So we all know that you can't count that test in which you order and you're billing for that test. So for instance, if your entity owns a CT scan, you ordered that test, you can't count that because you are billing for that service. Now, there are certain tests and studies that you order even though your entity runs the test and you bill for the provision of that test, you still can count that in your evaluation management. I'm going to go over that later, but let's talk about this unique test. This is the bad news part. So you typically would count anything that you order and anything that you review, like say a CBC, a CMP, a urine culture, any results that you receive, that you ingest in your practice, in your EHR, if it's a unique test, you usually count that as a single point in the data section. Now, what you cannot count, unfortunately, is included in this section. So if you look down here, a unique source is defined as a physician or qualified healthcare professional in a distinct group or different specialty or subspecialty or a unique entity. Here's the clincher. Review of all materials from any unique source counts as one element towards medical decision making. So review of all materials from any unique source counts as one element towards medical decision making. There's something to be said that you can be a certified professional coder. You can read the text, but if you don't understand it, and most importantly, if you don't know how to apply it, it's essentially useless. Let me translate this for you. This means if you were to get a bunch of records from your primary care doctor who referred this patient to you, and you're seeing this patient today, all those records in that one package typically is one big document which contains your analyses, urine culture, CT imaging, ultrasound imaging, the assessment and plan, the history, everything is included in this one document, this long PDF typically that gets faxed to you or however it gets delivered to you. That entire package from that one entity is counted as a single point. That's 1 point in the data section when it comes to medical decision making. Here's another example. If you were to get records from the ER, again, CT imaging results, you get culture results, you may get urinalyses, you may get labs, various labs. All those things that come in count as a single point when it comes to data. So that's the bad news. And this has been around since March of 2021. It is nothing new. You may not know about it, but it's nothing new. So that's the bad news. Let me share with you some good news. So this is from the CPT, the AMA CPT manual, and this is in on page 3 under services reported separately. As I may have mentioned earlier, the information that you get, the labs that you order from your entity. For instance, if you own a urinalysis machine, if you own a post-void residual ultrasound, some of these tests that you order are what's called results only, which means even though you are billing for the provision of that service, even though you are billing for the PVR, for instance, urinalysis, you get to not only bill for it, but you can also count that in medical decision making in a data section. So let me reiterate, even though you're billing for it separately, you also can count that in your data section in medical decision making. So this is counterintuitive, and it comes directly, I'll go over this directly from the horse's mouth. Services reported separately. I'll go over this section right here. The ordering and actual performance and/or interpretation of diagnostic test studies during a patient encounter are not included in determining the level of E&M service when professional interpretation of those tests/studies is reported separately by the physician or other qualified healthcare professional reporting the E&M service. Tests that do not require separate interpretation, for instance, tests that are results only and are analyzed as part of medical decision making, do not count as an independent interpretation, but may be counted as ordered or reviewed for selection of a medical decision making level. So again, normally if you order a CT scan that your entity owns a CT scanner, you order it because your entity is reporting the results. You don't get to count for the ordering of that test because you're billing for that test. Now, there are certain tests in which your entity bills for the provision of that test, and yet you can't count it. So these tests that you order are what's called results only. And if you Google, or actually go to YouTube and search for which CPTs are results only, you'll see a video by yours truly that goes over in detail how you can find these. Let me go over this in a very quick fashion. So in essence, you will look on cms.gov and you look for the physician relative value file. Once you open up that file, and at the time of this recording, it'll be January 2023. If you look at the file, it'll look something like this. This is the 2023 National Physician Fee Schedule Relative Value File, January release, 2023. If you look at column N as in Nancy, I highlighted it in yellow. It says PCTC indicator, professional component, technical component indicator. And if you look at, let's just pick a test. For instance, let's pick 81003. And so that's fine. 81003. And if you look at 81003 and you look across here, this is urinalysis without microscopy. If you look at here, indicator, PCTC indicator of 9. So any indicator that is 0, 2, 3, 4, 7, 8, or 9 are results only. So if you order a test that have those specific indicators, those are results only, meaning not only can you bill for it if you perform the procedure, you can also count that in medical decision making. So that is the nuance. That's the good news. So what are some of these examples? So if you look up 81003, that is one example, urinalysis. 51798, post-void residual, has an indicator of 3. And as I mentioned earlier, 0, 2, 3, 4, 7, 8, and 9 are results only, which means for post-void residual, even though you are billing for PVR separately, you can count that in medical decision-making under the data section. What is something else? PSA, your office may have a CLIA lab, high complexity CLIA lab, and you're billing for PSA. If you bill for that PSA and you order the PSA, you can count that in medical decision making under the data section, because that PSA 84153 has an indicator, a PCTC indicator of 9. And again, 0, 2, 3, 4, 7, 8, and 9, you can count those even though you are billing separately for the provision of that service. What you cannot count is a Euroflow 51741, because if you look up Euroflow, so let's look up 51741. If you look up Euroflow 51741, you look across here, it has a PCTC indicator of 1. 1 is not part of the list that I mentioned, which allows you to count the ordering of that test as well as provision of that test. So Euroflow, you can order it, you can bill for it, but you cannot count that as part of your medical decision making when it comes to the data section. So one bad news, one good news. This is nothing new. These rules happen. This technical correction came into play back in March of 2021. This is almost 2 years old. So this is some of the stuff that you really need to understand so that you're not leaving any money on the table. And for those of you who came up to me and asked for a selfie during the most recent Urology Advanced Coding and Reimbursement Seminar, thank you so much. I really enjoyed giving that presentation and participating in that 2-day seminar. The PRS Network has other courses that you can take so that you can be caught up on all these nuances. And as usual, if you have any questions, please leave them in the comments below. I look forward to interacting with everyone. Thank you so much for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.